I was told that this kind of thing was going to be very transient. Within a matter of days, it should go away. However, it not only persisted, it got worse. It was primarily localized on my left arm and my left leg. However, it has since spread to most all extremities, and I'm getting kind of concerned because to me, it's been several months, and that is getting into the window, what I'd call long term.
Hello, everyone. This is Kelly Brown here with you. And today I'm speaking with Gordon. And Gordon has a story that he'd like to share with the community. Gordon is someone who received a COVID-19 vaccine in September of this year and had experienced an adverse reaction after receiving that vaccine. And it's a story that could affect any one of us, really, and has certainly affected Gordon. And I invited him on to give voice to his story and to share with everyone what's happened here to raise some awareness. So hi, Gordon. It's nice to speak with you today.
Hey, Kelly. Nice to see you again.
So why don't you just go ahead and introduce yourself, give a few words about yourself before we go into your story.
My name is Gordon. I'm an academic research scientist and project manager. I have undergraduate and graduate degrees in developmental genetics and molecular genetics. I've been in the field for about 30 years and have been working at my current employer for about 20.
Okay, and can you tell us about what happened when you give a brief description of when you got vaccinated and the injury that's happened?
Sure. So I was vaccinated on September 16th of this year with the Moderna mRNA Covid-19 vaccine. On the 20th of September, I woke up and I realized that I had some pretty disturbing sensations, including numbness in my face, numbness in my extremities, and also mental fog, loss of acuity, and some pain.
I'm sorry to hear that, Gordon. And so were your original intentions to be vaccinated?
To be honest, I was a little bit hesitant. That word gets thrown around a bit.
Yeah.
Pretty cavalierly recently. I wanted a more complete picture regarding the safety and efficacy of these novel medications. This type of medication has never been used before, specifically as a vaccine. I wanted more concrete long-term data so that would meet my standard for informed consent, because I don't know what side effects that might await me down the road. And so far, I was not convinced that I was being presented with a fair, full picture.
And so why then do you think you ultimately chose to get vaccinated?
Well, I feel really strongly that I was coerced into taking that medication. I definitely did not give what I would consider to be informed consent. And the reason why I say this is that soon into the summer, the province had a mandate for certain sectors that they would mandate their employees to have testing or take one of the two mRNA vaccines. My employer changed that policy fairly quickly, and instead of testing as an option, they basically said, you take this vaccine or you are going to be put on unpaid leave and eventually terminated. To me, that is straight up coercion. There was either I was going to lose my livelihood or take a medication that I did not agree with the safety and efficacy of.
So getting back to, your unfortunate injury here. And by the way, are you still noticing some symptoms?
Yeah, absolutely. I'm still awaiting further assays and tests, follow-ups with specialists. I was told that this kind of thing was going to be very transient. Within a matter of days, it should go away. However, it not only persisted, it got worse. It was primarily localized on my left arm and my left leg. However, it has since spread to most all extremities, and I'm getting kind of concerned because to me, it's been several months, and that is getting into the window, what I'd call long term. And no one has an answer as to what the underlying pathology is, and it's taking forever to get an MRI. And I'm just the level of care with my case, I think, is pretty bad.
So it sounds like you've been kind of left out, wondering what could happen going forward with your prognosis. You're left wondering.
Yeah, because I'm on restrictions at work. I am unable to actually do the duties as described in my role. I can't do the activities that I normally did, such as like manipulating liquids or doing molecular biology or dissection, because I've lost dexterity and coordination in my hands. On top of that, my quality of life is reduced. I have, because of the lost coordination and neurological disturbances, I can't, I don't want to ride my bike. I'm worried about falling off of it. I lost strength in my leg and my arm. So I used to be an avid skier and an accomplished scuba diver. And those activities, which really help my life, are now not available to me because of this experience. And I'm really irritated.
Well, you have every right to be, Gordon. That's as I said off the top, this could happen to any one of us, and it should not have happened. So let's come back to that, but maybe talk about now. Maybe talk a little bit about what happened post-vaccine. So
okay, sure.
September 16th or whichever day it was. What
right?
happened?
Yeah. So as typically described by other people that have gotten these, the first day or so of these is pretty bad. To be honest, I never had an immune response like that before. I've had a bunch of other vaccines. I'm not an anti-vaxxer as they toss around. I've had pretty exotic boutique vaccines for travel around the world. Nothing has had the reaction for me that Moderna did, at least. So on the 16th, that was when I was injected. On the 20th, when I woke up, I went to work, talked to my employer about what was going on. They were concerned, I was concerned. They sent me to the emergency room. At that point, they did some assays. They ran a CT scan. It was determined at that point by them that I was most likely suffering from an adverse reaction to the Moderna mRNA vaccine. I asked my doctor at the ER at that time, if that's the case, are you going to file an AEFI report or an adverse reaction report? Because I think that's important for public health to know about these side effects, just from a scientific and public health standpoint, because they are novel. And surprisingly, my doctor said no, and which I thought was kind of weird, but I didn't push the issue, and because I don't know about any of the workflow for this stuff. So I reported that to my employer and did some more research and discovered that a couple of things. One, I'm personally able to file that report, which I found kind of strange. I thought it would had to come from an official channel, but I did. It was interviewed, or it was public health looked at the report. They interviewed me, and they investigated it and ultimately approved it. And they said my report was very professional and was full of useful data. I thought that was pretty good, able to contribute to that data set. However, the other thing that I learned is that there was a legal requirement for the care team that initially diagnosed me to file those AEFI reports. So that is the subject of a complaint that I have with the relevant regulatory agencies regarding that failure to file. So the other thing that I learned about my adverse reaction, just sort of the context of other people, is like just sort of trying to figure out from others' experiences, well, what do I have to look forward to here? How long is this going to last? You know, just the usual things, because a lot of people are taking these I thought it'd be, just talk to my coworkers, my friends and family. And it became clear that what was presented to me, at least in the literature and by my peers, as a rare side effect. So that I think that was like 1 to 10,000 was the figure I saw. But based upon the frequency that I was able to see with my coworkers, about 1 to 500. And that's not even doing a full survey. That's just like anecdotally talking to some people and having a brief conversation. So that tells me their numbers are off by an order of magnitude. It's not accurate at all. So it's either a failure to report or a failure to file. In either case, the numbers are pretty horrifying, and it's not what the public should be given a clearer picture.
Well, there's obviously some degree of underreporting, and we're just not sure what that number is. But evidenced by exactly your experience. So it was diagnosed in the ER by a physician.
Yeah.
This was likely or definitely due to the injection.
Yeah. So, I mean, nothing else happened to me. So the propinquity of that event, i.e. the injection, also with the reported side effects of it in the literature, it made a pretty convincing case. And then also my family physician, I've got 2 specialists that I'm seeing, an internist and a neurologist, and the general opinion is that they all concurred. Also, I was kind of disheartened to hear that there is an increase of these cases being seen this is like anecdotally, of course, by my care team, that is being seen by their neurologist in Toronto in the outpatient setting. So it seems to be an unfortunate occurrence. So
there's been about 13 or 1,400 cases of anesthesia, paresthesia in the province that we know of. And so back, we know that your case, had you not taken the initiative to file yourself, would not have been filed.
Oh, yeah, absolutely.
And so why do you think that is? Or
Well, my personal opinion is that I think this is all being sort of corralled into the general communication modality of preventing vaccine hesitancy. I think that they don't want people to be scared of this, because I think they may be coming from a slightly misguided public health standpoint that we need to vaccinate everyone to this percentage, which yet to be determined, to obtain herd immunity to prevent the spread of COVID-19. But at what cost? And I think that ignoring data that's important for the safety of medications to obtain that goal is pretty disturbing. I can't think of any other reason why they would do that. I don't think people are innately cruel.
Right.
I think it's misguided goodwill.
A system of maybe some perverse incentive.
Yes, yeah, I think that's the case. I mean, as far as I know, the manufacturers of the vaccines they're exempt from any kind of liability, so it's not on their end. I think it's a weird social contagion that I've noticed from the beginning of this pandemic, especially now, where any messaging anywhere against what is considered to be the narrative is met with derision, and you are outcast or fired from your job. It's really disturbing. I think it's the messaging from the federal, provincial governments is really upsetting. I think to be mild, they need to tone it down.
I think what I'm getting is, a real sense that your case in particular, you've had real harm to your person here, and it is being swept under the rug. You're left to feel that your case doesn't matter. It didn't matter to the physician who took you in. It didn't matter to him to make a report, to bring some light to it. and that, as maybe you said, that there's a goal to get everyone vaccinated.
Yeah.
And pointing out, and the risks are not something that if we point out the risk, we risk not achieving our goal.
Right. Absolutely.
And I don't want to put words in your mouth. Is that
No. I think
it feels like?
I think that's a big part of it too. And back to the doctors not filing, I think originally I thought, okay, maybe it's an abundance, like a ridiculous amount of paperwork, right? Like some people just don't. When cops have an incident, they have to fill out paperwork. When doctors have to fill out all this paperwork, no one likes filling out paperwork. Well, I don't know. I didn't know what I was doing. And I got the report and I filled it out really well, according to what public health said. It took me like 5 minutes, Kelly.
Yeah.
Like all I had to do was copy and paste some easy to find data from my vaccination records and then the medical report from the hospital, and just fill in some like very small factually driven paragraphs, and I'm like, boom, done. So it's not like the doctor had an overabundance of work to file these.
Yeah. Well, there have been about 15,000 of these reports filed, accepted, and reported. But I mean, how you had reached out to me about your scenario, and I'm just left wondering how many have experienced the same thing, or didn't think to ask their physician to file, and then didn't go home and file afterwards. And it's probably a big number.
A lot. And the more people I talk to, just like I go to my hairdresser or my dentist, or my wife talking to some friends of hers and colleagues, and it's pretty apparent that a lot of people have had similar or other side effects, and a lot of these people didn't have any there was no report filed.
Yeah.
And if it's as rare as they say it is, there's no way that I'd be hearing about it so anecdotally at such a high frequency. And I'm not embellishing this. Like, I have no horse in this game. I'm only trying to talk about what happened to me, because frankly, I'm surprised, because I heard about just the messaging and what people were going through before. And when I started experiencing it firsthand, I was sort of taken aback, like, I'm in a bad movie. This isn't real. Like, this kind of stuff doesn't happen, especially for something that's, it's not like world ending. At least it's not. It certainly is impactful and hurting a lot of people, and people are dying. But the reaction is at a level which I think is far outweighing the necessity of the reaction. It's really disturbing.
The reaction to COVID-19.
Yeah. It's the magnitude of the reaction is not commiserate with the threat.
It's out of proportion.
Yeah.
Well, what you're doing here is, you're a real life example of some of the harm that's been done to the population from these procedures. And I think it is very brave of you to tell this story and put a human face on one of these cases that we hear so much about. And I do hope that more of this conversation can take place and more people will come forward with a story like yours. I'm sorry this happened to you, and where do you go from here? What do you think is next step from you?
I don't know. My first concern is my health. That is an ongoing story. I don't know how it's going to proceed. I hope it just sort of either it attenuates or they figure out a way to treat it. But that's my primary concern.
Well, let me ask you a different question.
Sure.
What do you hope happens here going forward?
I would like people to, I'd like them to be able to relate to my story, to say, hey, this happened to me. And more people talk to other people, and hopefully there will be a popular groundswell. I think that's where it's going to, the politicians aren't going to change their policies. There doesn't seem to be enough momentum by their constituents, us, to help drive them in the right direction. I'm really appreciative of this outlet, because I think not only from my health and in my, like, where I work, but I've had many relationships, both professionally and personally, that are destroyed because of this. It's very upsetting that what makes us as human, and having relationships between other humans, it's breaking down. And that really says something's fundamentally wrong with where we're going as a society. And if anything that I can do to help right the boat, I'm for, because frankly, I'm out of options.
Yeah.
No one short of people like you and others that are advocating for people like me and the voiceless other thousands in the province. We need a voice.
We do. Well, Gordon, it was very brave of you to come on today. That was very well said. And we'll I think you've probably touched some people today, and you've probably let some people know that they're not alone. You're not alone. We've got your back, and we'll be hoping the best for you, and I'm sure we'll talk again soon. So anything else? You're welcome. Anything else you'd like to say before we go?
No, just Merry Christmas, and I hope you have a happy holiday.
Thanks, Gordon. You too.